8 things women should know about pregnancy tests. Some 100 years ago, women had to pretty much guess whether they are pregnant or not. The first sign was, obviously, the missed periods, which could also be due to many other reasons. This shot in the dark changed as technology evolved. Having changed from critical tests and ultrasounds to a mini test kit, the latter is all that you need now to know whether you are pregnant or not. But how accurate are these pregnancy test kits? How safe is it to rely on them? To solve these confusions, here are certain important things you should know about pregnancy tests. Though some expensive brands claim to be more accurate than cheaper ones, that's not true. The only difference between the cheaper and the costlier ones is in the way the output is displayed. The cheaper ones show lines and expensive ones explicitly says if you are pregnant or not. So, spending more on a pregnancy test kit makes hardly any difference. In fact, what matters is to check whether a test is faulty, damaged, expired, or used incorrectly. As a matter of fact, issues like these can occur with any brand or style. So, while buying a test kit, check the expiration date on the package and read the instructions thoroughly. For the most decisive result possible, it is recommended to take the test during the first pee in the morning. There is a reason behind this. Pregnancy tests work by measuring level of HCG, human chorionic gonadotrophin, which is most concentrated when you go to loo first time in the morning. You can, of course, take the test at any other time and maybe you will get the same result. However, for the most accurate result, you should take it during first pee in the morning. Pregnancy tests are 97% to 99% accurate, leaving the remaining 3 to 1% as a potential margin for error, false positive or false negative. These cases can be when you are on certain kinds of medication, such as tranquilizers, fertility drugs, or anticonvulsants. This can also happen if you have had a chemical pregnancy, which means the sperm technically did fertilize the egg, but the pregnancy, sadly, did not continue. This happens in 50 to 60% of first-time pregnancies. This is one widespread pregnancy test myth that needs to be busted. The amount of HCG in your pee can rise equally either you are expecting a boy or a girl. Any test that promises to tell you pink or blue is, honestly, lying. So, it's best to stop googling most popular baby names until your post-20 week scan and test. Just like other medicines, pregnancy test kits also have an expiry date after which they don't work. The chemical used in them to detect HCG is no longer effective, which means that your result will go wrong. So, if you are planning to conceive and have stocked up on test kits, please do check the date before using them. You should not drink much water before taking the pregnancy test as it may dilute your urine and may not give accurate results. Women who take fertility drugs that contain HCG may not get accurate results with the pregnancy test kit. However, normal medication, birth control pills and alcohol does not affect the test. The test results, which have 2 lines, indicating pregnancy, are a little confusing when one of the lines is faint. Some women may think they are not pregnant, but that's not true. A faint line also indicates a pregnancy. The faintness or darkness of a line can depend on the brand and how sensitive the test strips are. So, it is better to go and meet your gynecologists after such a result. HCG is a hormone that is produced by your body when you are pregnant. It's detectable in the blood and urine shortly after you conceive. HCG is made by cells formed in the placenta, which nourishes the egg after it has been fertilized and becomes attached to the uterine wall.